Dr. Jacobs report part 2, I was telling you what the 2 medications were that I was on that stopped the tremors and 70% of my pain. The first one was Ataquan. You can't see that. I'm sorry. You already saw it in the first one. But it's a mirror image of that for some reason. But that's what it is. And he wrote it as Meliquan. 750 milligrams twice a day for 10 days, and zithromycin 600 milligrams daily for 10 days. That's what took 70% of the pain away, and the head tremors and the hand tremors. Okay, so the rest of the report. That's why he started me on the Ataquan and zithromycin, because there was a concern for another tick-borne illness. Evidently, your symptoms did improve, but you then disappeared, and I have no idea what has happened since. When my husband called, he's a nice doctor, I'm not going to say anything. Number 5, precancerous colon polyps. You are a bit young to have had this high-grade precancerous polyp. Regular surveillance is important. You are a bit, 6, history of alcoholism. Like I said, I'm a recovering alcoholic. I haven't drank in 12 years. I was going to AA, and that's a whole nother story. I'll tell another time, because I just recently stopped going to AA. I've been vaccinated. I have a heart murmur. I like to smoke cigarettes. Temporomandibular joint tenderness. This reflects, I had TMJ really bad. I should wear a mouth guard. Abdominal pain on exam. I don't have that now, but I did. Iron deficiency. Imaging of chest, abdomen, and pelvis. We need to look for any underlying infections or tumors that could be contributing to your joint aches. Sugar and caffeine excess. I'm always tired. I tell you, I don't take the amount of caffeine that I did when I was on that Lyrica. That was killing me. And I was going to have a heart attack if I kept up with that. Thank God I'm off of the Lyrica and the caffeine supplements. I was in a car accident when I was 23. Headaches and light sensitivity, which I have horribly. But another medication that Gemsic, because I'm going to Gemsic now, prescribed, helps that a lot. I will startle easily. Like if I'm doing something in the kitchen and my husband comes in, I won't even notice he's there until like he's been there, and I'm like, whew, startled. Or lights sometimes, or when I'm driving, even if it's during the day, blinking lights or car lights will give me a severe migraine. My children, whom I love dearly, are very noisy, and they're screaming or yelling when they're playing with one another. Gives me a severe migraine and just starts pain in me. It agitates it. Lower back pain, which is always felt like I was getting an epidural, always, since I got sick. It's like I had a spinal tap, and that is not nearly as painful as the back pain that I have because of this stuff. The spinal tap I had for them to check was like, ooh, okay. I had seizures when I was a child. My hands and my feet are always freezing ice cold. Ice cold. I had blue toes at this time and tingling of my hands. Possible toxoplasmosis exposure. The blood studies were completely normal. I have no idea what that is. Abnormal HPV, but the PAP was fortunately normal. Trace of blood in the urine. No infection was noted. Decreased pulmonary functions. This does prompt an imaging study of your chest. It also should inspire you to get off cigarettes ASAP. So thus the gum. It's only been, 3 years since this report. Possible MRI of the cervical and lumbar spines. Oh, these are things he's suggesting. Okay. Industrial. That's what he said. Industrial. I was using industrial doses of caffeine. As mentioned, getting off should be helpful. Sleep issues. We talked about the importance of getting you to sleep. You were reluctant to take any medication because of your alcoholism history. I started some medication to see if this would help. Obviously, I have not heard from you. Yeah, you can. He was pretty upset that he did not hear from us at that follow-up. All right, so, good luck. And that's it. So that was the report. Just an overview real quick. The medications I was on. I'm going to turn this around, maybe not. I'm sorry, I don't know how to do that. Okay, if you could just put this up to a mirror, you'd be able to see it. Meliquan, 750 for 10 days. Zithromycin, 600 milligrams, twice a day? No, daily for 10 days. The Meliquan was twice a day. And that was in a little packet. I remember it was like this big, that wide, and it was some kind of gooey liquid, and I had to, push it and suck it up. So one more time on these medications from Dr. Jacob, if I can find them. I really can't. Sorry. I'm going to pause it. I swear I flipped through this thing 10 times. Okay. None of the blood studies confirmed any residual tick-borne illness. Because of the concern about possible babesia, I initiated treatment with atovaquone, Atovaquone. That's what he had written here as Meliquan. 750 milligrams twice a day for 10 days. And azithromycin. 600 milligrams daily for 10 days. And again, this took 75% of my pain away. And the tremors, took the tremors away. I wanted to show you what the tick bite looked like. As again, I said I had what I thought was a mole on my back, but with the kids, I never took the time to turn around and look in the mirror at it. I just noticed it was getting bigger and bigger, and I would mess with it sometimes, and it would hurt a little bit. So I just left it alone, but then I'd mess with it again. We went in the pool on a Wednesday, and it fell off. So it had been on there about a month, and there it is. We had two pictures. One picture we left with a doctor, and we don't have it. It was the red circle you could see better on the previous picture, but if you look, you can kind of see a little tiny red rash around there. And there was something else I wanted to show you. Here it is. These are the lab results. Okay, first, this is the clonidine. This is the clonidine report. If I can see. Okay, so I went to GemSick recently, and they said, based on this report, some of the markers are very light. Like that one. And there was another one, I guess. And they were, here's more. Some of them were light enough, see, that she didn't have to do another extensive blood panel to tell me I had chronic Lyme. Based on my symptoms and this blood report, she didn't have to do another Lyme. I'm just going to run through my lab work that I had done back in 2013, and I'm going to tell you the abnormalities if there are any. Okay, so I flipped through the blood work from 2013, and vitamin D was L24, which was low because it's supposed to be 30 to 80. CRP, I don't even know what these are, so I'm ignorant in regards to that. Not knowing, ignorant. Not, that's what it means, not knowing. CRP high sensitivity H3.97. So I guess it was 0.97 too high. Cholesterol and triglycerides were both high. Cholesterol then was at 223, triglycerides at 401. And I'll tell you, before I got sick with Lyme's disease, I was eating whatever I wanted. You know, I like McDonald's. White blood cell count at this time was not extremely too high. It was that means high. 11.8. That's only 0.8 high, but that I know I had more blood work done since this, a lot more, and it just kept getting higher, the white blood cell count. Hemoglobin was high at 5.8, only 0.1 higher than it should be 5.7. Ferritin, Ferritin, 25. And I don't know. CH50 was high at 158. Okay. And here are the markers. And see, only it said only one of the strips was dark enough at that time. I don't know if this means anything to anybody, but, you know, there's my heart, I guess. Something's off. FEV1. I'll just read the numbers. 3.40 pred. Best 3.57, 105%. 3.53, 104%. 3.35, 98%. Yeah, it looks good. All right, so that was it for the day, and there was something else I wanted to show you. I'll take you to my phone, actually, because it's on my phone, and then I'll read it. I will forget that I wanted to tell you this. Man, I was still recording. It's okay. Yes, I'm sitting on my counter because I don't have enough energy to stand up. Okay, so I just really quickly wrote down some things, and they're on my phone because I have to take notes a lot. What aggravates my illness? Noise, light, sugar, gluten. I am currently lactose intolerant. I have headaches behind my eyes, but now the headache has just like, my whole head feels like a bicycle pump. If you stuck it up your nose, I've never done this, but if you stuck it up your nose and started pumping it, like, my head is just filling up with pressure, the whole thing. Numb hands, freezing hands and feet, rectal bleeding. Yes, I have rectal bleeding and constipation all the time. Memory loss, chest pains. Oh, I could have had a possible seizure. Confusion, blurry peripheral, then gold spots. So I was like, I could focus on what was right in front of me, but the whole peripheral part was blurry and like flickery. And then I told my husband I'm not feeling well. I went upstairs into the bathtub, and these little golden floaters appeared. My arms hurt to be touched sometimes. I cannot wear light bracelets because the rubbing of the bracelets hurts. I cannot carry the laundry up and down the stairs. I struggle to go up and down the stairs sometimes, most times. Wrists crack, my wrists crack, like 6 times a day. My back cracks when I stretch it, or not even have to really struggle to stretch it. My back cracks like 10 times a day. My neck cracks like The Exorcist 3 to 4 times a day. My shoulders, especially my left one, this one, feel like it's blown out of the socket. My shins, this is a great feeling. My shins feel like a child with a metal baseball bat is running and he tings you with the baseball bat, not on purpose, but on accident, and it goes ting, and it just hurts. Enough to curse, but, hands, hips, shoulder blades, and back hurt. Severe back pain, constant, it's worse than a spinal tap. Shaking on the inside after conflicts, like if my 15-year-old is arguing with me or my husband. Number 3, I'm going to have to do another video. I'm so sorry. Adios.